So, oh, go ahead. Okay. So our first panelist is Molly Bryant, who's the Director of Case Advocacy at the YWCA in Tulsa. Molly, do you want to share a little bit about?
Sure. Hi, everyone. I'm Molly Bryant. I use the pronoun she, her. I am a social worker by trade, and I worked at Domestic Violence Intervention Services for many years as our underserved outreach advocate. So I worked mostly with populations on the margins. So particularly for today's talk, I worked with a lot of criminalized survivors. So survivors in our Tulsa County Jail, and also immigrants within our Tulsa County Jail. So those who are held on immigration holds. Right now I'm doing refugee and immigration work, but it also it also ties very closely to domestic violence in the work that we're doing. I am a proud member of the Cherokee Nation, and I have a really adorable 8-month-old named Zephyr, who is now my world. And I used to always mention my 2 dogs, who I also love, but now I have a baby, and so I feel like I don't mention them anymore, but I have 2 really adorable dogs and a great partner.
All right. Thank you for sharing, Molly. Colleen McCarty is going to be our next panelist, who's the founding executive director of Oklahoma Appleseed.
Hi, everybody. Super excited to be here. I'm an attorney, and I just recently founded Oklahoma Appleseed Center for Law and Justice, which is a piece of a national network of law centers around the country. We're the 18th center in the network. There's even one in Mexico City. So if you've ever lived in Texas or Kansas or Missouri, you've probably heard of other Appleseed centers. We're all independent, so we all work on our own specific issues. A lot of them work on immigration or poverty issues. Here at Oklahoma Appleseed, one of our flagship projects as we get started is working to support criminalized survivors. And so we've just launched the Oklahoma Survivor Justice Project, where we're gathering stories of women in Mabel Bassett who are survivors of intimate partner and sexual violence. And we're working to pass a bill that is like New York's Domestic Violence Survivor Justice Act here in Oklahoma, with a big group of folks, a lot of whom are here. And I'm excited to see you guys. And so we'll be talking a little bit about that today. Thanks for having me.
Okay. And next up, we have Dr. David McLeod, the Associate Director of the OU School of Social Work.
Hey, hi, everyone. Yeah, thanks for having me here. See a few names that are pretty familiar, some new friends to make as well. I am coming to the conversation as a researcher and former investigator. I started off my career as a police detective, worked in crimes that affected women and children, relationships, what they would call on TV special victims type crimes. Then became a forensic social worker, then needed some more student debt, went back to school, and now I'm a professor at OU. I originally came to Oklahoma because we tend to incarcerate more women than about anywhere else in the developed world. At the time, I was trying to understand differential criminal behavior development, and forensic psychopathology was what we used to call it. So just how people get to the point where they're engaging in behaviors that would find them in contact with the legal system. Working with incarcerated women here in Oklahoma actually moved me toward research surrounding family violence and the incredible impact that what I tend to call relational violence, or these kind of dynamics between relationships, how those things are connected to all these other negative outcomes for women, particularly in Oklahoma. So I'm just an investigator. I go to where the new questions are. And so over my career, that shifted a little bit. And this is some of the space I'm in today. Hopefully get to talk about a couple of the research projects we have going on now and how they're connected to understanding better how to support survivors.
Thank you. The next is Giovanna Lopez Medina, who is a law clerk with Stump Immigration.
Hi, everybody. My name is Giovanna, as Danielle said. I just graduated from law school. And prior to going to law school, I was the director for the Domestic Violence Victims Assistance Program at the YWCA. I did that for a couple of years. And prior to that, I worked at the Latino Community Development Agency as their domestic violence and sexual assault advocate. So I primarily worked with Hispanic and Latino victims of domestic violence and sexual assault. And of course, while I was at the YWCA, I got to work with victims from a number of places. And that is, Molly shared that she had an 8-month-old. I have a 2-year-old who thinks she's 13. So yeah, it's a lot of fun.
All right. So now that everybody has kind of heard a little bit about the backgrounds and kind of the work from each of our panelists, we'll kind of get started asking some questions. I do invite it to be more of a conversation, so please feel free at any point to ask any questions, whether you feel comfortable just putting it in the chat, messaging me directly, or if you feel uncomfortable, feel free to unmute and ask any questions that you may have, whether it's to the panel or any specific panelist. We are happy to kind of work with that. So to get started, what does it mean to center the needs of survivors, and why is it important? Whoever wants to go first.
I'm okay going first on this one. I mean, so the work that we do around domestic violence should always be centered around survivors. So the movement has kind of lost that along the way by like professional, well, there's a lot of reasons for it, but really like what it means is like respecting survivors, respecting them as the experts on their own lives. They're experts on their own safety. So like as professionals, as social workers, as advocates, we often think we know like what is best. But usually our survivors know. We might have access to like certain amounts of information that we can give to survivors to help them make good choices or make choices for themselves, but survivors should truly always be trusted. And then also to me, it means that we are meeting people where they are. So there is not a one-size-fits-all approach to domestic violence and sexual assault services because everyone is unique and everyone brings their own like needs and skills and resources. So like ultimately just creating relationships with survivors and helping them like promoting emotional and physical safety, promoting survivors' ability to have more control over their lives, things like that. But always central to what we're doing and always from survivors first.
Yes, thank you.
I'm new to this, but I can go for just a second for my small piece of what that means to me is that I think it's important to remember that a survivor doesn't stop being a survivor just because the criminal legal system might be prosecuting them or putting them in jail. Oftentimes the impacts of trauma, PTSD can cause certain reactions or can cause us to treat trauma with things like drugs or risky behavior. And that can lead to prosecution. And oftentimes we see situations where people are not getting the services they need because they've fallen on one side or the other of the prison walls, unfortunately. And I've met so many survivors in prison since we started this project that have really felt like they stopped being a survivor and started being a criminal, and that's just how everybody saw them. And I think we have to start applying the same lenses to every survivor, no matter where they are, their age, or what they might have done as a response to the violence that was being perpetrated on them. I mean, it's frustrating for me to hear so much focus on women who are being prosecuted for crimes that are a result of their survival, and not enough focus on the perpetrators of the harm. Not that that always needs to mean prison every time, but I just hear so much about why this woman deserved to go to prison, and not enough about any type of accountability for the person that perpetrated the harm in the first place. Like, it almost always could have been prevented. The prosecution, the prison, and everything else that happens after that, if more accountability had been placed on the original harm instead of the reaction to the harm.
And what I think about when centering the needs of survivors are cultural differences, religious beliefs, language barriers. What does your lobby look like? Do you have staff who is fluent? Do you have the ability to communicate with people effectively? And so realizing that people from different backgrounds have different needs, and just creating an environment in which, one, they feel safe to go to that place in the first place, and then two, providing a space within the location that allows them to feel secure and safe in seeking assistance. And then one thing that I always think about is, for example, and it's just not true it's for a number of victims, their status, whether they're undocumented, not documented, with even those that are documented, and what their misconceptions are whenever they are willing to report or not report a crime. And so thinking about those things when providing services to victims.
I would echo a lot of what my colleagues have said. I mean, it's crucial to practice in general, especially with any vulnerable population or group of people that's been traditionally or historically marginalized. But I would add to say, for me in my practice, all across the career, and especially in the research, centering others is not a destination that we get to in our practice. It's a habit we create, right? Because it's constant work. I have to work past and work through my straight white manness on a daily basis. And I remember earlier in my career, I had this strong belief, because I'm not near as evolved as most of you probably, that I will just ride in on my white horse and save all the women and children, and look how great I am. And that wasn't about me. It wasn't about them. It was about me. And it wasn't that I wasn't trying to do good work. It was that I was naive and young and trying to figure out. And over time, and a lot of hard lessons, I figured out that it's not about understanding exactly what's happened in someone's life as much as listening and trying to get away from our assumptions. At the same time, as a researcher, as I know that we all view the world through our own lens. And so just knowing that walking in, being conscious of that walking in, for me is a really helpful part of practice in working with other people and trying to understand where it is that they're coming from. Some of the research, particularly about relational violence, that I've done in the past few years, which actually started in working with incarcerated women here in Oklahoma, really dug into the data and understanding how is it, because a lot of my stuff came from like not understanding why people would hurt folks that they're supposed to take care of. Right? But I have my value judgments and assessments that are then imposed onto that space. I still struggle with it because I don't get it. Well, some of this research that we found over time was that what the ebb and flows of all of our relationships fluctuate extensively in time. We have good days, we have bad days, most days are hopefully good. And that at some point, things cross over for that individual in their relationship where it moves past a consensual struggle for power or autonomy or whatever into an abusive space. And there's a lot of dynamics that play onto that, but then our culture tends to blame people. Well, why didn't you know? Why didn't you do something? Why didn't you pick up the early signs? Why didn't you? And the reality is that we all are on a daily basis trying to assess where we are in the world and what's going on in our lives. Several of my colleagues mentioned having children. I've got children. every day I'm trying to figure out what I messed up on and how did I fail that big? Why did I miss this with my daughters? I completely missed the boat. And I think everybody's trying to figure that stuff out. So centering ourselves on kind of really helping survivors is about that, meeting people where they are. And it's something that we know, I think, as helping professionals intrinsically, but it's something that we can communicate with data pretty effectively as well.
Thank you, everybody, for all of your responses. Kind of building off of that question, why don't you just leave, or why didn't you do this sooner? Kind of all of those harmful things that survivors may be asked. Can you all share a little bit about why survivors may not want to leave or might not be able to leave?
I promise I'm not going to talk the whole time, but since I was just talking about it, I'm going to mention this. I'm going to put a link over here in the chat as well. In our research, that became a really good question about why people don't leave, right? So there's a million different reasons, and abusers know exactly what your reasons are. And so the data show it over and over again. What we ended up calling in the research as a sentinel event were things that held people in abusive relationships. Our legal systems might call that hitting someone, but we know from the research that that's the smallest part of it. So it's this emotional abuse, psychological abuse, the constantly kind of tearing someone down, and then even moving past those implied threats into overt threats or demands about people's lives. In our research, we've also found that any type of threat about separating a woman from her children is more powerful than the fear of death. So that's the context of the data, and it sounds pretty heavy, and I guess it should. That is more motivating, whether it's a threat suggested to the harm of the child or a separation in the relationship between the woman and child. Nothing that I've been able to see in the data so far was that powerful.
That was one of the first things I always think about is like how often I have heard survivors talk about how their abuser has used children against them, threatening to take the children, threatening to get the woman in jail so that she's separated. I mean, all kinds of ways. I think that's really like something a lot of people can identify with. Like that's just like gets to you. Also though, like survivors, when their abusers threaten to harm themselves, it's really like, I think we often kind of assume that there's like this like good and evil happening, like someone is fully good and fully bad. And so survivors are these pure people and abusers are just evil and there's no love. But often survivors are still in love with their abusers. And that's normal, right? Like that's just human nature. That's part of it. There's nothing wrong with it. So when survivors know that, when abusers know that, when they threaten to harm themselves and like it's real, which it often is, I mean, that's a huge motivator to stay. You don't want to be responsible for someone's death. Like you don't want to be responsible for the person you love hurting themselves. So again, like we could probably do 2 hours listing out all the reasons people stay. But that's one that I hear a lot and I think is incredibly powerful. I mean, also every targeted identity that a person has is another reason to stay. So I worked with a lot of deaf survivors, and for any small community that you are in, you often know everyone in that community, whether it's being in a rural community, being in the queer community, or being in the deaf community in Tulsa. And so there are very few interpreters. I mean, it goes into like these really like nitpicky things, but like there are very few interpreters for ASL in the Tulsa community. They all know each other. So a survivor doesn't come forward because they know that whenever we call an interpreter, it's quite possibly going to be someone that already knows them and their abuser, and maybe their abuser's brother, so it's like there's all these reasons that people stay, and they stay to keep themselves safe. Like that is it, they're not staying because it's dumb. They're staying because they've been surviving and they know what keeps them safe and they know what escalates their situation. So staying is often the safest option for a very long time. Yeah, that's just a few of them.
Yeah,
In the Hispanic community, sorry, Colleen, in the Hispanic community, this was something that I learned whenever I started working at a Latino agency, was that in Latin American countries, there is something called abandonment of the home, and the parent who abandons the home loses rights to the home and the children. And so they come to the United States, they don't understand what the norms are or what their legal rights are, and they get threatened that if they leave, they're going to lose their children and they're going to lose their home and they're going to lose everything. So understanding that it can be first generation, second, even third generation immigrants, if they have not been involved in any shape or form with the law, they don't have a reason to know otherwise. And so keeping that in mind when working with survivors, unless you somehow are able to bring that conversation up and explain to them that that's not how it works, then they may not know. So it's definitely something to consider. And it may be true for other countries, but I know at least for a fact that in most Latin American countries, that is how it works. And abusers will use that because that's how it works in their home countries.
I just wanted to say everything everyone has said is so poignant and true. And then I wanted to add that, you know, especially in Oklahoma, but lots of other places, our citizenship is so traumatized here, including abusers themselves, particularly women who have endured any type of child sexual abuse or abuse in the home, often go into relationships with people who perpetrate the same harm. It's kind of like the devil you know versus the devil you don't. And it's a pattern that people are acting out because they haven't healed their trauma, and we don't have good access to trauma care here. We don't have good access to mental health care here. And the women that I've been talking to, I mean, it's hard to know that you need to leave a situation if you have never known it was a problem. Like one of the entries that we got on our survey said, I didn't know I was a domestic violence survivor until I was already at DHS and I was being investigated for enabling abuse. And I saw a poster that said all of the signs of what abuse was, and I was all of them. But I didn't know that until it was too late, because that had always been my family dynamic. It had always been my relationship dynamic. I didn't know there was anything about it that was weird or that I needed to report. And so I just think we expect a lot of people from the outside looking in. But when we don't understand really like the environments that these people are coming from, a lot of people have lived with situational and relational violence their entire life. And so it's not something that they would think that they needed to leave. It's like, I have a house, I have food, I have money in the bank. This is a pretty good situation for me. And so I think a lot of this is trauma and healings, like generational cycles of trauma. Instead of just asking why they didn't leave, it's like, where are you in the knowledge of this dynamic, and how can we help you kind of advance your knowledge to the point where you can recognize that there might be something better out there for you, that you could become a stable person on your own. I mean, a lot of it is economic. I think there's a lot of economic pressure for people, especially when they're in dynamics where they're told they can't get a job, they can't leave the house, they can't have a car, like the coercive control type situations. I think those kinds of situations, it makes it harder because there's the economic pressure to stay, but then there's also the lack of knowledge, and it's hard to reach those people, especially in rural areas. And so I know I'm preaching to the choir about all of this, but it just seems like something that's been pronounced in a lot of the survey subjects that we've gotten back.
Yeah. So thank you all for sharing. Like, it sounds like, and like how you each had different spins on it, because that is a very complicated question. And as Molly said, we could spend 2 hours just talking about that question alone and all the different manners, and it's very different for each person. Um, Colleen, you kind of started talking about like what the next question is. And so like as a community, where do you feel that we fall short on ensuring that survivors have access to services or just services in general that would kind of help to eliminate these
Yeah,
intimate
so
environments?
I think the folks on this call are like providing 99% of the domestic violence services in the state. So please understand, I'm not criticizing any of the work that you guys are doing. I'm deeply grateful for everything that you guys do. I know it takes a real toll, and there's a lot of vicarious trauma associated with that, and I appreciate all that you do. However, our services in the state are abysmal. Honestly, we are not providing services we don't even have enough services to address the current level of calls that are coming in. I mean, Brandon, who's here, posted a graphic at an interim study we did on criminalized survivorship a few weeks ago that showed that there are 43,000, Brandon, if I say it wrong, please jump in, but 43,000 calls in Oklahoma County alone every year. And less than 1,000 of those lead to criminal arrests. And yes, some of those are doubled, right? Some of those are coming from the same person. They're not all tracked for individual data, but that's a lot of calls. And even if the YWCA was answering and servicing all of those calls, they don't have enough services to address all of those calls. They just don't. And like, we don't in Tulsa either. But no, I mean, there's also the fact of like, not just intimate partner violence or relationship violence services will address this, right? Like I was saying before, we don't have access to, I want to say precautionary, but it's not precautionary. It's like proactive mental health care and trauma treatment for people who are coming out of extremely traumatic childhoods. We can't expect people coming out of really traumatic and painful childhoods to just like automatically make really healthy decisions. I mean, some of them do, and that's like a miracle once in a lifetime person that does that. But that's not how human behavior works. And we know we're the #1 state that has the highest number of ACEs. Like, we already know that. So if we already know that, it's kind of like negligence for us to not be offering these for every kid in every high school class. I mean, it's like it should be a high school class, how to overcome and heal your childhood trauma. Send them to therapy. Like, we know it needs to happen. It's not like, oops, we didn't know. No, we know. I mean, like, there's just no services at all. And people are just kind of left to fend for themselves. And then we're shocked when people are making decisions that keep them alive. Like Molly says, I mean, we're making decisions that are like, okay, it's either I live today and eat enough food or I don't. How can we expect people to do any differently if we're not giving them any tools or anything that they need?
I mean, I even think of, this is not a very because so domestic violence impacts the whole community, right? And the community impacts domestic violence. So I think about even how little we invest in public transportation, right? Like it's things like this where you don't necessarily automatically see the connection to domestic violence and survivorship and accessing resources. But as communities, we have not invested in like even just the infrastructure to keep survivors safe, to let them access our services. So we can create like more accessible services that are like survivor centered. We can provide language access for folks. But if they cannot get to the location, then they're not able to receive the same kind of services. If they, and it is like you mentioned, Colleen, it's prevention work, but it's also access. And so access looks really different to each person, but we don't even have an infrastructure in place for people to get to services. So we could provide like really beautiful services in-house, But unless we are buying buses and going out to rural communities, which has been like an idea, right? Because of the lack of access, unless we're doing that, we're not meeting people where they are. We're not investing in prevention. And so I think a huge part of it is being able to recognize all these different ways that prevent survivors from getting to safe places and to finding healing. Like unless we're able to connect it to all these other things going on in the community, all the systems at play, we're never going to really address access, because it's just going to be in our own little DV, social work, lawyer, law is the right word, worlds. And really it's all community, it's everything that we touch, employment, housing, everything.
And I would like to add, so the Hispanic community is very afraid to drive into certain areas, like specifically downtown, because guess whose headquarters are downtown? OCPD's. And if you take a wrong turn on a one-way street, you're going to get stopped. And so you're looking for domestic violence services, but now you've encountered another problem, right? And so these are things to consider as well. As it has been mentioned, I know that the people present here today are probably providing 90% of services in the state, but you know, I don't know, meeting people where they're at, having different service centers, not just throughout Oklahoma City or Tulsa, but also in our rural areas, and we're not there yet.
I would just add a little bit more globally to particularly the topic that Molly started for us. And that's the connection of literally, you can see Griffin walking around with his cone of shame on. Poor guy. Griffin the dog.
Show us.
Here. All right, Griffin, come here. Come on, come show everybody your. Oh, he's embarrassed. Come on.
Oh.
Come on. Can you see him down there? Come here, buddy. Oh, no.
Oh.
So embarrassing. Yeah.
Thank you.
Oh, so embarrassing. The dog. All right, bud. He's usually a ham, wants to get on screen as much as he can. All right. Griffin always sidetracks me. But the connection, I've got one of the projects my research team's working on right now looks at these state scores and that what are the kind of statistical relationships between them. So lots of folks are probably familiar with, we're like 48th in education, 44th in crime, 46th in healthcare, #1 in ACEs, #3 in female homicide at the hand of a male. There's lots of really wonderful scores. All of them track together. Like when we talk about like how this thing is connected, it's all connected. DV is connected to education. It is connected to healthcare access. It's connected to gender equity. By multiple metrics, Oklahoma is the worst state in the US for women to live in. Multiple studies have come out to say that. It's not just economics, it's all kinds of other policy implications as well, and social problems. So all of those things are absolutely connected to each other. We're able to see it statistically in some pretty broad ways. And I think the people in this screen probably already know that. We already know that in education is connected to XYZ negative outcome. Child abuse perpetration is connected to XYZ outcome. But a lot of times we need to be able to have the data to support arguments like that. So we're actually going to be putting together some fact sheets to send those around with quick talking points to help us in our conversations, hopefully over the next few months, to get that information out there, because people will, you know, it's just us bleeding hearts. All the libs out there saying this stuff happens that it really doesn't, right? But no, I mean, it absolutely does. So the quality of life for women in this state is intrinsically connected to all these other outcomes in some pretty prolific ways.
Looks like we have a question from Kenzie in the chat. Colleen, are you able to share? Let me move this, it's closer.
Yeah, so we've gotten, I think, over 100 surveys back from women specifically at Mabel Bassett, who are self-identifying as criminalized survivors. Now, like me looking at that lens as an attorney, that's not everybody who's self-identifying is going to fall into that actual legal definition, but there are some surprising themes that maybe you guys wouldn't expect. We're seeing a lot of charges for enabling child sexual abuse and enabling physical child abuse. Now, of course, as citizens of a state, we would find that behavior, of course, completely abhorrent, especially if you have a child or live with a child, you know. But also, you know, if you have a child or live or around children frequently, how frequently they get injured and hurt themselves or have bruises or unexplained injuries. And these are crimes. When I worked at the district attorney's office as an intern, as a law student, that are treated with such strong disdain and disgust, and for good reason, within a certain definition, right? Like within a limited scope. And please don't take anything I'm saying as like that we should be abusing children in any way. But there are a lot of these cases where these women are being prosecuted for behavior that they may or may not have known was happening, but when it was happening, they were also being abused in multiple different ways, financially, sexually, physically, emotionally, every way that you can imagine. I mean, you can't be in a situation where someone's hurting your kids. Like, it's just like what Dr. McLeod said. It's like if someone's threatening your children or the safety of your children, it's stronger than death. Like, it's deep in our psyche from when we were cave people. So you have to imagine that the fear and the threat of harm is pretty extreme for you to be in that situation and know it's happening to your children, but also to be in that situation and not know it's happening to your children, because like we know, people who are perpetrating harm in the home are very good at manipulation and very good at covering things up, coming up with excuses. And people who are living in a home with someone who's perpetrating harm are really good at believing the excuses, because it's honestly a way that they can continue to exist. In the current, it's denial. It's a way that they can. And so I'm not saying that enabling abuse is permissible, and I'm not saying that child abuse is okay, but there has to be more nuance than what we have in the law currently, right? Like enabling child sexual abuse, enabling child abuse, those are 0 to lifetime ranges. And that means whether I knew about it or not, I face 0 to life. Whether I was being abused or not, I face 0 to life. And it's just, I see so many cases where it's like these women, whether or not you agree they're criminally liable, they received an excessive sentence by like any stretch of the imagination. And so I think this is a really difficult issue for a lot of people, because it's so nuanced and it's complicated, and it has to do with kids, and it has to do with mothering, and it has to do with something that we hold so dear as a society, which is people being a good mom, people being good mothers. It's like we take it very seriously, especially here in Oklahoma, where women are, like you guys are saying in the chat, we're supposed to know, supposed to be omnipotent about all the behavior that's happening in and around our child all of the time, even when we're not with them. And yeah, exactly. So these are people having guns held to their head, having physical injuries at the time when the crimes are being perpetrated. I mean, yeah, it's just it's really complicated and messy. And when you start to read the stories, a lot of them, I mean, the older cases that I see are mostly women who are in very, very abusive situations from the 80s and 90s, and either they helped their partner perpetrate a crime and they went down for co-conspirator liability, or they hired someone to take out their partner because they didn't feel there was any other way out. And while both of those types of behavior are horrible, there's just no good solution for those people. I mean, there's probably no policy solution that we're not gonna be able to go up to the legislature and say, stop prosecuting people for co-conspirator liability when it was an abuse. That's just like not gonna work. So it's just really tragic situation that I think it happens enough to think that this is a problem, but not enough for people to think we should do something about it. And so it's kind of this like really sad subsection of survivorship that if you've ever been into Mabel Bassett and you've met these women, you will know that they're not threats to society. They're not out, carrying weapons and guns and gonna hurt anybody, but they're there for the rest of their life. And it just feels like such a waste of human potential. Sorry for going on for literally forever about that.
Can I add something to that? Because obviously failure to protect hits a chord with all of us, right? I mean, I think often about this. So I worked with several women who were in for failure to protect-ish laws. So Oklahoma stopped doing as much failure to protect and started doing more like child neglect, but it was just under the guise of child neglect. It was failure to protect. And there's like this one woman who was just a couple years younger than me. She kind of like, and I worked with, when they're in the jail, they're there for ever. So I would be with them for like years before they were convicted and went to prison often. But this one woman kind of wanted to go through her experience over and over and just kind of like really wanted like me to tell her like where she went wrong. And we went through, and so I was like, all right, let's go through this. And it was like, if she had come to me, like sometimes we're like, if they had been able to access us, then we would be able to stop this like thing from happening. And that's just not true. So like maybe she would have had more of a case when it came up, like when the jury could be like a little bit more compassionate because they were like, she sought help. But what she did in order to keep her child safe so the woman's abusive partner for like a decade was abusing her horrifically from they were the age of like 14 until she was like 30 something, was also abusing her daughter, but she didn't find out until much, much later. She did everything we would have asked her to do. So like the safety planning, she did it, right? She knew her resources, she sought out help, and she still ended up in prison for 22 years and lost her daughter. Her partner was incarcerated, which that doesn't always happen, right? Doesn't always happen but I mean, it's like, even if we were to stop it, even if we were to not stop it, even if we were to offer resources and do what we do as advocates, we can't stop it because, Colleen, what you mentioned is like, there is no nuance in the law. The law is black and white. And even when we tell people, this is what it looks like to seek help and to protect yourself and your child, doesn't mean that they won't end up incarcerated because of it. And that's just like, I was there. It feels hopeless sometimes because of that, because you're like, well, what's the other option then? She's just in a bad situation with no option, really.
It's the true like Batman dilemma. Remember that Batman like episode where he has to decide between like saving Robin or saving Catwoman or whatever it is. I can't remember who the other person is, I'm sorry. But he has to like swoop around and save both of them somehow. And it's like this magical maneuver that no one else would be able to do. But seriously, that's the situation they're in. If they do what they need to do ultimately to save and protect their children, oftentimes they perpetrate a crime against the abuser, go to prison for assault, battery, or murder. If they do what they need to do to protect their children, to stay in the relationship, to prevent them to keep from hurting someone, then it's enabling. And so they're both a life range, guys. So, but at least one way, the person who's perpetrating harm is no longer perpetrating harm. I mean, like, I don't know how to advise somebody in that situation.
Does anyone else want to add anything to that? The failure to protect and kind of the incarcerated survivors present a lot of challenges. as we kind of go through a lot of the nuances and kind of look through all of that and kind of figure out how we deal with those cases, how we
I see
respond.
I see a question about the press coverage.
Yeah.
So you guys have noticed, I'm sure, that there's a lot more press coverage on some of these higher profile cases like Tony Hall and Rebecca Hogue and Carrie King just came out in Mother Jones. And then we've been working on a case with April Wilkins, who, like you were talking about, Molly, she did everything right. I mean, she made mistakes, but in my case with April, like she sent her child away. She like did everything she was supposed to do. She tried everything to try to get away. She tried to get help. There was no help. So like, that's one of those situations that just breaks your heart. But I do think that the press coverage is helping, because I've had a lot of people reach out to me with specific outrage about these cases that they're seeing. And it's like, also there's new lines of coverage about women who are pregnant, who are using marijuana and being prosecuted, that the Marshall Project has been doing. And so I think, honestly, with the new Supreme Court decision about abortion and some of these other attacks on, just generally, I consider them to be attacks on women, although women are not the only ones being put in these situations, but it feels like, as you were saying, Dr. McLeod, attacks on women, people are getting more and more angry about these. And so I do think the more we can shine a light on it and explain it in long form text, like either podcasting or long form articles or things that, you know, catch people's eye, that allow us to explain the nuance of these situations, because oftentimes there are bad facts. I mean, speaking as somebody who is working on defending a DUI right now, like, everybody has bad facts. These have bad facts, almost all of them do. They have things that got said in the trial, or things that the police said about them, or things that they were on record saying that make their cases look particularly bad. And if you can't explain it in a longer form, it makes it difficult for people to understand. And so, yes, if you guys have cases like these, or that are particularly upsetting to you, that you think, of all the ones I've worked on, this one really bothers me, I'd love to know about those. If you can email me at colleen@okappleseed.org, because we are trying to collect a repository of just, you know, well, what about this woman? She tried to get out of it this way and this happened. And what about this woman? And she tried to do this and she still got prosecuted. We've been looking at a case where there was a child death, and they knew who the murderer was. And instead of getting the murder conviction, they had given him a plea deal for child abuse so that he could testify against the woman. They were more concerned about prosecuting a woman for failure to protect than getting a conviction on a murder, which is shocking to me and doesn't make any sense as someone who used to work in prosecution. Just shocking to me. I don't know. Some things just, I'm glad that my outrage is shared with you, Amber.
I was just going to comment to that one as well, just briefly, that increasing coverage and increasing awareness it's an important first step, but we have to maintain it. So I would think the socio-political powers that do not want to see people that care about the things that we care about advance those ideas are banking on the fact that we will get tired in the typical news cycle and the stories will go away. So we have to find ways to maintain momentum and keep pressure on, and connect these to the larger kind of context. And somebody mentioned Roe v. Wade a second ago. Connecting these issues to some of those larger issues, and I do believe they are connected, is going to be an important part of what to do to move that forward. I also think we have to be strategic in that the moment we open up, we have to be able to tell the context of the story. And when that becomes acceptable, everyone gets to tell the context of the story. And now we got complicated again. So if we look at the abusers in these situations, they come from abuse backgrounds and marginalized backgrounds as well. It's an uncomfortable thing to have to say. It doesn't make it okay what they do, but it's true in the data. And so when we open that door, it also gets opened in that space. And so are we ready? Like, and so part of it is thinking through strategically, how do you get ready for that type of counter? And then does the solution, to what degree is the solution the criminal justice system, and to what degree are our solutions elsewhere?
I see a question about solutions. I know we can get caught up in like talking about the problem a lot, but I'll just take this opportunity to discuss a law that we're working on in our coalition for criminalized survivors. There was a law passed in New York called the Domestic Violence Survivors Justice Act. I don't know if you guys have read it or are familiar with it, but essentially it creates a resentencing provision for people who have enough evidence to prove that they were being abused at the time of the crime, and they can put that before the sentencing court, and then they can also appeal if the sentencing court still doesn't believe they were being abused, and they can be entered into a lower sentencing range than what they originally got. We are customizing that policy for Oklahoma and working on some, we don't have any final language yet, and we're working with Representative Hassenbeck, who's from Elgin, Oklahoma, on this policy. There are a lot of things that have to come between now and legislative session, so we're not like really super openly publicizing the law yet, but we are trying to gather community support, and I think anyone on this group who's interested in supporting that, we would love to have you. Ours will hopefully be two-pronged, so we'll have help for people who are currently being prosecuted. That way they would just be sentenced in the lower sentence range from the first place. And then the people who are already inside would be able to apply back for resentencing. So like on the proactive and on the retroactive. I know that this doesn't solve the problem because you're already looking at someone who's facing prosecution by the time this law would even take effect. And like you guys are saying, prevention is more important than treating a symptom like a runny nose. But I feel like we're getting some traction on treating the runny nose, so we're going to run with it. So yeah, I'm happy to answer any questions about that or how to get involved, but I think it's at least a place to start. And the nice thing about that is at least the way we have the law formulated right now, the underlying crime doesn't matter. So like it could be failure to protect, it could be enabling, it could be self-defense, murder, it could be whatever the underlying crime was. So that way, at least strategically, we don't have to open up those statutes to try to amend them, which we do need to do. Don't get me wrong. We need to amend the sentencing range for child abuse. We need to amend the sentencing range for failure to protect. But as you guys know, the Oklahoma legislature will not even look at opening those statutes unless it's to make them more punitive, which we don't want to do. So we've been trying to attack it from the side, which is the sentencing way is a nice way to do it because you don't have to like get into opening all of those icky statutes that people get so mad about. And then the politicians don't have to look like they're being soft on child abuse or any of that. So yes. Okay. Thanks, Molly. No, I mean, we need to do both. I think we need to do prevention and we need to go back and fix the harm that's already occurred. So it's like, we need to like attack it coming in to the middle, if that makes sense. But yeah, I'll send out information on how to get involved to everybody here on that, but I'm going to stop now.
I'm going to pick up like, I'm right there with what Colleen just said. I mean, it's about doing both. The way that trauma, everybody here knows the way that trauma works, it's viral. Trauma is infectious. People put their trauma that they have onto those around them. If we don't both address the symptom and the source, then it just keeps repeating itself. And I think that's some of the struggle that we have as a community is how do we effectively create a coalition of sorts and with a broad strategy on how do we address this in the moment. We can't not use our criminal justice system because that's the main tool right now, but we can supplement and adapt and adjust. But yeah, it's definitely the both and be in it for the long haul because we're going to have to really figure out what the new norm is. Our state is more traumatized than any other state in the country, and it shouldn't be shocking that we have these problems in such a prolific way. Another thing I'll mention, as if it needs to be said, it kind of does, I don't know, I never know. This is one of those, it's uncomfortable to say. People need to understand how abusive their behavior is. Like, men need to be accountable from early on to understand that this is not how you resolve problems of insecurity or fear of loss of resources or whatever your power dynamic is. We have cultural things that we have to get to. It's not just about the kind of martyrdom of mothers or the Madonna complex that Oklahoma seems to have in such high demand, but teaching boys how to be good men in the social constructs that we have is going to be a really challenging thing to do. A lot of times it's very obvious when abuse happens. What we know in the data is so much of the time, what you feel is abuse, I don't. What I feel is abuse, you don't. And it gets really sketchy and weird and gray and hard. So those spaces are going to be the difficult ones, but those spaces also almost always predict the worst stuff, right? So how do we get in there earlier? It's got to come from every different angle. So hopefully that mumbo jumbo made some sort of sense.
I'm no longer working for a domestic violence agency, so I'm going to say this. Our funders are really limiting what we're able to do. So the reason I agree with everything but all of you have said, the reason I was prevention, because our state does not fund prevention. And the reason is because our funders, you cannot prove that something didn't happen because you had money to help the problem, right? You can't prove it. You can't prove a negative. And so we have all of this stuff on the back end, and we will continue to have all of this stuff on the back end, and we will continue to be the most traumatized state in the nation because we don't have the funding to do anything for prevention. And that funding isn't just we have all these ideas that we could do, but we don't. We don't even have the funding to explore other opportunities. So we don't have the funding to even look into what does that look like as a state? Yes, anything. And that typically is stuff outside of the criminal legal system. But all of our monies are tied either federally to law enforcement. So we must have them in our CCRTs, or the philanthropies and private funders are saying, well, we need data to show that what the money we're giving is being used wisely. And so we're kind of damned if you do, damned if you don't. There's nowhere to go. And those are specific things that we should be lobbying for. Not lobbying, but pushing for with funders is if we actually want to move the needle, we've got to go to the beginning. And that looks also like all the things we've talked about around lowering ACEs. So all the things on the ACE scores, working on that is prevention for domestic violence. So it just could look like so many different things, but as a state, we just haven't had the ability, the time, the funding, the capacity to even invest anything in prevention. And so that's my fear, is it's going to be generations until this issue is addressed. Because we're all exhausted, right, from doing the back end of the work. So I should be more positive, but that's how I feel.
So Amber shared in the chat about how bananas it is to be teaching things like consent and rejection to 18-year-olds, which is, often the first time that people are getting any kind of consent training. If anybody has other questions, you can add them in the chat. I'll go ahead and ask another one. Why are some reasons that survivors may not want to involve law enforcement or other systems of power when they are experiencing domestic abuse? And some of you guys have already mentioned a lot in here, but we'll kind of hear some other reasons.
Because law enforcement can perpetuate the cycles of power and control in so many really, really harmful ways. Just from like even calling for police to show up to help like intervene in a violent situation, we know that we know that abusers are really good at manipulating that situation. So I've definitely worked with survivors who have been arrested for domestic violence because their abuser used their language. So like, if you don't speak the language and your abuser does, they're able to pretty easily convince law enforcement. And I say this generally, yes, I know, but they're more easily able to convince law enforcement that they're the ones who are being abused, and that typically this hysterical woman, right, is the one who is out of control. Because whenever law enforcement arrives, she may be the one that looks out of control. Also, law enforcement, like involving law enforcement is scary if you do not have documentation. It is scary if your abuser does not have documentation, and you don't want them to get deported either, because they, again, you may love them, they may be your children's father. Law enforcement is taking it to a different level that honestly survivors lose control when they contact law enforcement. Their control of the situation is gone. And so often law enforcement and then the legal system take it from there. And it is not, as we know, not client-centered. They do not get to choose what happens to their abuser. And this is like my soapbox. I could go on and on about this. I will let other people go and I'll jump in if I feel like I need, but this is what I could talk about forever, because it is one of the most misunderstood parts of survivorship.
I was going to add something data-wise and then turn it back over, but one of the things that we found in some recent research is that particularly people and communities of color will wait until in our community right here, will wait until a situation has escalated way further before they're willing to bring law enforcement in. So there's a compounding effect happening. The likelihood of something good coming out of that starts to go way down as the tensions flare. And by that time, everybody's tried to protect themselves. Being a person of color in our community makes it even harder. We live in an environment where systemic racism is real and it's part of our criminal justice system, and we have to admit and acknowledge it to do something about it. That is, from some of the research we've done in the past couple of years, the probably primary place where we see it the most is in those fight and disturbance calls, where people just don't want to call. So if they do call, stuff is bad, and they know it's going to get worse.
I know Yvonne probably has some awesome things to say about this, but quickly, I just want to juxtapose two situations. We got involved with a case, a woman who's been incarcerated for 25 years for shooting her abuser. He was abusing her for 2.5 years. There were 14 police reports, 3 rape kits. Everything she could have done, she tried to do. And every time she called the police, it got worse. So because there was no accountability for the violence, he was shown that there wasn't going to be any accountability. So then he became more violent. So it escalated through cycles of her involving authorities. Every time it was like a bigger circle. And now she's in prison for shooting him. He is deceased, and she's a survivor in prison. Now I thought, okay, since that happened in 1999, things must be so much better now. I got a call last week on a Thursday from a frantic family telling me that their sister, daughter, fiance just got found guilty by a jury last week in Wagner County because she had a protective order out against her abusive ex, and 3 times he had violated it prior to him showing up this day. There was no following up on the violations of the protective order. The cops did try to refer charges one of the times to the DA, and the DA declined to prosecute. So we're not just talking about the authorities as far as the responders, we're talking about the people who are responsible for referring charges, who are filing charges. They're declining to prosecute. So that happened last week, and she just got recommended for 15 years. She shot him. It was an abdom, so A-B with a domestic, that with a dangerous weapon. And so it's not like it's something that's old and doesn't happen anymore. It's literally happening in our communities right now. Yes, I mean, there is a situation where it's like sometimes something looks like it's too much work to do if you're a prosecutor, or there's too much chasing people down for a low-level case like this. My witnesses aren't going to show up, nobody's going to cooperate, so I'm probably just not going to prosecute. Or there's just like, I didn't make it to the bottom of my pile in time, and it just expired by the time that I needed to get through the paperwork. I mean, a lot of this is just systemic, like our public servants are underfunded and understaffed, and there's so many cases going through. And like, if anybody ever asked me if I think more funding needs to go to prosecutors, I would actually say yes, because they're not processing the cases fast enough and correctly enough, and doing enough research and getting the witnesses lined up to actually prosecute a lot of these cases. And you guys know that. But currently in Norman, we're being told police won't take reports unless victims are going to file. What? Holy God. Okay. Wow. Yeah. So, I mean, another added to the pile of reasons we're not going to call. Like, we're just literally saying we're not going to keep you safe. It's tit for tat. We're not going to keep you safe unless you transact with us.
And Holly knows I have this story that I told on the podcast, but again, I'm just going to go for it. So I had a county district attorney tell me, like, you need to get your victims to testify. If they're real victims, they'll testify. And that's like yeah, guys, like, said it with like gusto, and as if there was like, yeah, like, has probably said it a million times. But
weren't you at a restaurant too? Like, this happened to you on your personal time?
Yeah, I was at a Mexican restaurant and got cornered. Like, at least I'm full, and I just kind of like laughed and was like, wow, we have very different perspectives on this. But that's the kind of thing, right, where like they won't do it unless victims participate. And like, that's a big part. Victimless prosecution should be a big part of what if we're looking to the criminal legal system for solutions, that should be a big part of it. But does not, I mean, it's shocking and yet not surprising, right, that that's also happening in Norman.
And as you know, just I want to reiterate everything everybody has said, because those themes also affect communities of different backgrounds. And I think, looking back and listening to you all speak, one of the biggest things that I remember victims telling me was essentially what David said earlier, that they would be threatened by their abusers, that if they call the cops, that they would lose their children. So that was always like at the top of the list as to why they wouldn't call, because they didn't want the police to be involved. They didn't want that DHS call, that failure to protect. And so everything comes together, right? And then, of course, even if they are documented, even if they do have a legal status, there's hesitation and fear that if you call the police, there's going to be legal repercussions as to your status and you're going to be deported. And so I remember being at Palomar and victims being hesitant to talk to our detectives there, because the cops that would show up to their homes would, tell them things that were problematic and essentially re-victimize them. So they don't want to talk to the cops, or the police officers didn't speak Spanish, and the language lines that they used weren't helpful. So it's just issue over issue over issue over issue over issue. And It just makes it really, really hard for victims to want to talk to law enforcement. And, there are things such as VAWA and U visas where if victims report these crimes, there's an avenue for them to be able to get a legal status someday, but they have to cooperate. How do you cooperate? How do you trust the system? How do they trust the system? How are they're afraid that they're going to get their abuser deported. They're afraid that there are going to be repercussions to other family members, and they just don't want to take that step.
That's such a huge thing, like, that people don't understand, is in order to get the VAWA or U visa, you have to actively participate in the prosecution. And then you're also not, it also doesn't protect you when you're in the process. It doesn't protect you from deportation. So if you know all of that stuff, it's like, oh my gosh, it's even the things that are supposed to be there to protect survivors really aren't fully protecting them and only help a handful, right? Oh, that's such a good point. Thank you for bringing that up.
There's one more thing I want to say on this. I'm sorry, we're like belaboring the point, but there was a woman that I worked for in commutation who called the police for a domestic violence call. They came, they found drugs in the house, and they arrested her for being, the child was in the home and there was drugs in the home. So she got child endangerment and possession. That was back when possession was a felony. And so you're looking at situations where oftentimes, and I think it's probably subconsciously, but abusers will introduce drugs or other illicit substances or get people involved in illicit markets or prostitution, because those are illegal activities, and no one who's involved in an illegal activity is going to call the police on them, right? So it's like you're also looking at these positions of people who are marginalized because of the activities that they're engaged in that may or may not be their own choices, or they're being trafficked, or they're using drugs to enable the trafficking. And so I just think there are so many more ways to discourage someone from calling than there are benefits to calling, that you can't expect somebody to do that risk analysis and come out on the other way.
So Kinsey had a question and wanting to get the perspective on the panel on DV per prosecution. Realistically, how helpful, short-term or long-term, is it for DV survivors to see their abusers prosecuted? So Cloud said 38%. Oh, that's related to comments.
So I think Molly has this research on Tulsa County DV prosecution that Ryan did, which was that there were over 20,000 calls the year that they did the study and less than 600 prosecutions. And that's different than arrests. So there were more arrests than 600, but only less than 600 ended up going to prosecution. So like, you just have to assume from those numbers that people aren't getting a lot out of this. First of all, you're having to re-traumatize yourself to go through the process. Oftentimes you have to take off work, go to the prosecutor's office multiple times, help them with their investigation, gather the witnesses, participate in this incredibly exhausting and traumatizing process, especially if you're a sexual assault survivor and that's the type of crime you're getting someone to prosecute. But let's see, on the DV prosecution, realistically, how helpful is it? I think if you are in a dangerous situation, you're seriously dangerous situation, you need to be separated from your abuser in order to keep everyone alive, then calling the police and getting him put in jail, if you can do that, if that's the outcome, which often we can't guarantee, is the best thing for that short term. But oftentimes those prosecutions fall apart. Oftentimes someone's bails that person out. Oftentimes there's retaliation for putting that person in jail. So I just don't think I don't know if there's a good answer for that. Molly probably has a better answer, but there's just so many side effects to trying to prosecute, both long-term and short-term. I mean, long-term, you're putting someone in prison who might be the breadwinner for your family, who might be paying you child support, who might be helping you feed your children. And that's just not realistic for a lot of people, especially right now. Yeah, I don't think there's a good answer for that for me.
I mean, this is kind of like the $1 million question, like what is the good, right? And for me, just after working in, like, as an advocate within the criminal legal system, I fully believe we will never incarcerate ourselves into safety and healing. Like, it's just, it has not happened as of yet. And I do not think it's possible. I don't know what, like, there are a lot of, again, funding makes a big, causes us to not really know what the other options are, but there are some really good, like, alternatives. So again, it's being client-centered, it's meeting people where they are, it's asking, what does justice really look like to you? And for most people, the only option to justice has been the criminal legal system. And so whenever people, and most people don't get justice through that, right? So it's helping survivors understand what are even the other options. And for some folks, it may look like Indigenous healing practices in their own communities, right? It may look like their abuser being isolated from their community. That may be justice. Or justice may be their abuser getting help. Like, that may be what justice looks like, because again, this is their children's parents and they just want the best. So I think it's like, incarceration doesn't do our community good in the long run, right? It may stop, it may be those like immediate violent events that happen. It separates someone from who's causing harm from the person who's receiving it. But long term, I mean, David does the research on long-term effects on incarceration, and it is not making us safer or better. And so I cannot, and so that's why, like, my hope is that we don't continue to invest in the incarceration side, and we instead invest in something else that's more creative and maybe more localized.
Oh, yeah, just to support that, Molly, data is overwhelming. The more you incarcerate, the less safe your community is. Like, it's not even a debate. It's kind of like global warming. There might be like 2 people out there who say it's not true, but they haven't looked at actual science. Sorry.
We're in this position of knowing that it doesn't work, but not having a better solution. It's like for a chemo resistant cancer, like, you're still going to go to chemo because it's like the best thing that you have, but you know it's not going to work for some percent of the case. Like, that's where we're at with incarceration, I think, as a society. It's like, well, we know this doesn't work. We haven't divested from it yet. And we aren't investing in research to figure out what better tools there are. So we're just kind of like riding the curve until someone figures out what's better. But generally, incarceration is like a supercharger for learning bad behavior and violent behavior as a response to your surroundings. So if you take someone who's been using violence as a way to express their emotions or express discomfort with their current reality or whatever, and you put them into a situation with everyone else in the state who's been doing that also, they're not going to come out a lot like learning a lot of tools that are helping them not be violent. It's just not going to happen. It's like we're accepting that we're fine with everybody going there and getting worse than they were when they went in. Like, we're just accepting that. It's like going to a Denny's. Like, I'm gonna walk out worse.
So for our last question, what would a more survivor-centered approach look like for you all?
Okay, I'll start. Again, like, if you're doing from a DVA side, from an advocate side, if you're client-centered, you're in conversation. So you're in conversation with client as an individual, with a survivor as an individual person. And so I think a more client-centered approach is saying, you're the expert on what this looks like. You're the expert on what you want. Like, what does justice look like to you? And again, that doesn't mean that people are always going to know how to answer that necessarily, But at least even having the option, like the choice can be really overwhelming when you don't know what all the choices are. But if we start to know some of what the choices are outside of the legal system, you can say these are some of the things that other people have done, right? This is what other survivors have said. Does any of this sound like something that would help in your healing process? And some people may say, no, I just want this person in prison for the rest of their lives. And that's going to be their approach to it, right? But so many people are like, I just want him to get help. And so I think, again, like just going right back to the survivor and saying, what does it look like? Because we can have options, but we don't know what's going to be satisfying and what's going to be justice for someone.
I think for the service providers, having advocates, male, female, LGBTQ, people of color, people of different backgrounds, providing services to victims, that just opens the door to victims feeling more comfortable, feeling better about being there, feeling like they're understood, et cetera, et cetera. So perhaps going that way.
I would add, I think these are great responses. I would add that we have to remember that this event, this relationship, this problem that this human being is facing is absolutely a big deal in their life, but it's not the only thing that they are as a person. There are so many other components to their life, and that as you improve the quality of life in general, you have a better shot at sustainably changing the patterns that they have in the different types of relationships that they're involved in. It goes for all of us. The more power a person feels in general, the more access to opportunities and resources we have in general, then the easier it is to deal with these really heartbreaking problems.
So I would say, like David's comment is hitting me, that's in the chat, that says we have to find a transition plan away from incarceration that doesn't leave a gap in the community for violence to occupy. I think the best way to approach that is harm reduction, and like practicing abolition where we can, and each of you are in a place where you can, and that means, unless it's absolutely necessary, trying to divert people from the system, trying to figure out ways to repair the harm that is a restorative approach that doesn't involve incarceration. Because like we were saying before, there's no situation where someone goes into a long phase of incarceration and comes out and is able to rehabilitate their life back to the place where they were before. The research shows, Jennifer Doliak's research shows that there's no amount of money or time or resources you can put into a person on reentry that will get them back to where they were before they experienced a period of incarceration. So diversion is so key. Therapy is so key. Mental health care is so key. And I would recommend a book. It's called We Do This Till We Free Us. It's Mariame Kaba. Many of you may have read it. It's about a societal response to, abolition and practices of harm reduction. And I think taking the system where it is, like we take the people where they are, taking the system where it is and working it. Like it may not be a solution that's going to fix everything, but like creating a procedure where women who have been incarcerated for decades could apply to get out. That's revolutionary in Oklahoma. It might not be revolutionary in New York or wherever else, but it is for us. And we just have to meet it where it is and accept it for what it is, which is, it was put in place with good intentions and it hasn't been working. And then try to fix the pieces that aren't working. And even if it's not 100%, doing what we can where we can, I think is my answer to that, which is a big problem, but each of us in this room can do a little something to try to limit the harm of these systems.
Thank you. I did want to give everybody a few minutes if they have any closing remarks or anything that they would want to share. I know we're pretty much at the end of time, so if anybody has anything that they want to share.
just say thank you. It's an honor to talk with you and to learn with you and to be a part of the conversation. So thank you for inviting me.
Yeah, when I left the DV world in Oklahoma a couple of years ago, this conversation would not have been happening. And so I am just like really moved by everyone's like what all the chat and what everyone said. And it makes me really excited for the future of DV movements. It's just really exciting to see like things progressing, and I'm just really, really like honored to be back in this space. So thank you all.
Yes, thank you. And I don't know, once you're in this world, I don't think you can ever get out, and you see it and you see its effects and its impacts, and you can just never get out. Yeah. So thank you for the work that everyone does.
I echo everything everyone said. Thank you guys so much for having me. And if you want any more information on getting involved with the coalition that we're creating around criminalized survivorship, I'll send my information to Danielle, and you can sign up to be a volunteer or join the coalition, whichever you prefer. And thanks again.
Thank you so much for everybody who came, and thank you to our wonderful panelists. It was so great to have you all. And Molly, it's so encouraging because sometimes it is hard dealing with all these systemic failures. So just kind of hearing you talk about reminding us of how far we've come in these conversations. That is really encouraging. So thank you. Thank you all. All right. Well,
Thank you. Bye.